this session, we will start with the urinary system. So, what do you know about the urinary system? So, you start with the function. So, from the function, removal of toxic material from the body, from the blood. Let us start with the structure. So in the structure, what are the structure of the urinary system?
Kidney.
So the first part, which is the kidney. What is coming after the kidney? What's the those things that coming like this? Huh? What we call them? Huh? Ureter. So how many are there? 2 ureter are there. Then they are going toward the bladder. So the bladder is there. So start with the kidney. 2 kidney are there. Then from the kidney 2 ureters. Then the bladder. Then urethra. So the urethra is taking the urine out. So this is the general structure of the urinary system. So urinary system composed from 2 kidney, 2 ureter, 1 bladder or 2? 1 bladder only, and 1 ureter. So we come to the objective of this unit. So from the objective of this unit, we will describe the structure and function of organs of the urinary system. So we will take each organ and we will see the structure of it and the function. Describe anatomy of the nephron. What's the nephron, by the way? Did you know anything about the nephron?
Inside the kidney.
It is inside the kidney.
To
But
filter the blood.
so it is the main unit for main functional unit of the
Kidney.
urinary system or the kidney. Its name, it is similar to what?
Tail.
Sorry? Nephron and neuron. Yes, thank you. So it is similar to neuron. Neuron is the functional unit of what? Of the nervous system. So nephron is the functional unit of the urinary system. Nephron is the functional, neuron is the functional unit of the nervous system. So describe the anatomy of nephron and explain its importance in the structure and function of the units of the kidney. Describe the process of urine formation, how the urine will form in the kidney, and identify the area of nephron that are responsible for each process. Then describe the function of the kidney in the excretion of nitrogen and waste, other waste product, and describe the role of the kidney in maintaining fluid and electrolyte balance in our body. So the kidney, it is the kidney, from the kidney function, it is not only the formation of urine. It is formation of urine and maintaining the balance of what? There are many balance that it maintain it. Water balance, pH balance. What other thing? I hear something. Yes, electrolyte, thank you. So electrolyte balance also is maintained by the kidney. What other thing? Fluid balance. So water balance or fluid balance within the body. So it has many functions to do. And so the function of the urinary system, one of them which is elimination. Elimination, it means, what we mean by elimination? When we eliminate, getting rid of. So it is elimination, it is getting rid of, discarding. So the getting rid of the nitrogenous waste, which is the urea, and also any toxic material within our body. So it will be excreted mostly with the urine. Drugs that we are taking, drugs, if it is accumulated in our body, it will be toxic. Yes, it will give its effect within a certain level in our plasma. But if that level is exceeding the advisable level, in this case it might be toxic. So it has also, there is a metabolism for the drug also. For each drug, it's different from drug to drug. So there is a metabolism, and most of the metabolism it is done in the liver, detoxification of it, and then it will be excreted mostly with the urine. And so those are the functions that eliminate. From elimination also, we have also regulation function. From the regulation function, it will produce enzyme. It is not only, most of us, we might think first when we think of the urinary system, we are thinking of urine and urine formation. But there are enzymes that are produced by the kidney. The renin is produced by the kidney, and that enzyme, it regulates the blood pressure. So in any defect in the kidney, you will find that the blood pressure, it will be affected. So either it will be high or low, it will be low. Also, from the function of the kidney, it is the production of the erythropoietin. Erythropoietin, what's the function of the erythropoietin? Yes, so it is enhance the bone marrow and production of the red blood cells from the red bone marrow. And the kidney also convert vitamin D to its active form. The form of vitamin D that we are taking, sometimes it is not in active form. So the kidney is activating the vitamin D in order to give its work. Also, from the maintenance, they are maintain the water balance. So the excess fluid in our body, it will be washed out, it will be taken out as a urine. If the body is in need for fluid, or if we are not taking enough fluid, you will see that during those days, especially during summer, our urine, it will be more concentrated, and the color of the urine, it will be slightly dark. Why it's slightly dark? Because especially if we are not taking enough water, because some of the water, it will go through the skin and sweating. So in this case, we will come to the nephron and the function of the nephron. The reabsorption of water will happen in order to prevent further or loss of a huge amount of water from our body. So it will save the water in case if we are not taking enough water in any day. Electrolyte balance. What are the electrolytes that you know? The electrolyte like what? A, which is the sodium and potassium and chloride. So mostly we are concerned with the potassium and sodium and chloride. So it maintains the balance of the electrolyte in our body. And also we know the importance of the electrolyte in our body. You studied the electrolyte balance and the importance of the electrolyte for maintaining. Also, it will help in maintaining of the water balance, the electrolyte, the presence of electrolyte, and also it will help in what? Transmission of the impulses. Sorry? The impulses through the nervous system. And also it maintains the acid-base balance. So when the blood is acidic, in this case, it will increase the excretion of hydrogen with the urine. By the way, the urine, mostly it is alkaline or acidic or neutral. Mostly it is? Yes, it is. Mostly it is acidic. So the pH of the urine, mostly it is acidic. Can be neutral, it can be alkaline in some of the cases, but mostly it is acidic. So it will maintain acid-base balance and will maintain also blood volume and pressure. The blood volume, how it will maintain the blood volume? How it will maintain the blood volume? What's the relation between the blood volume and the kidney? Sorry? From? Forming of blood, you mean? Here we are concerned about the volume. Volume, it is, what we mean by volume? So it is the quantity of the blood. So how it will maintain the volume? The volume of the blood in of our blood in an adult. How much is it? It is 5 to 6 liters. So it will maintain that amount. How it will maintain that amount in the size? How it will maintain it? By? Yes, so it is by the absorption of water, by keeping water in our body, because most of our body is water, and most of also the blood, it is water. If you remember, the plasma, it is mostly water, and it is mostly consists more than 55% of the blood is plasma. Even the blood cells, it has water. It is not dried. If our cell is dried, it means that it is destructive. It is useless. So those are the main function or the generalized function of the urinary system. So see how much is the our urinary system is doing, or our kidney is working and doing some work in our body and maintaining many processes are there. As the structure that we have for the two kidney, two ureter are there, and then the urinary bladder, and from the urinary bladder we have the urethra. So those are the main organs of the urinary system. So the main organs, the two kidney, two ureter, bladder, and urethra. Here we see, what is this? This one. Artery. Which artery is it? This one? Huh? What we call this artery? No, the big one, not this one, the small one. Aorta. So it is abdominal aorta. So this is the abdominal aorta. This is the arch of the aorta. This is the thoracic aorta. Then this is the abdominal aorta. So it takes its blood supply here from the abdominal aorta, from the renal artery. So two artery, right and left. Renal artery are coming. Right is going toward the right kidney, and left is going to the left kidney. So this is the blood supply to the kidney, and we will come to the blood supply inside the kidney later in other slides. The blood is going back from the kidney through which vein here? Renal vein. It is going toward the hepatic vein, then then it will go to the vena cava inferior. It will go to the vena cava inferior. So this is the vena cava inferior, and here the hepatic vein. It is a branch that take the blood from the liver. So this is the vena cava inferior. What is this which is coming over the kidney? What is this part, this yellow part that's coming over the kidney? Gland. What we call this gland? Adrenal gland. So adrenal gland, it is over the kidney, and it has also and if you study it in the endocrine, and it has a role in maintaining of what? Maintaining of what? Mostly it's working with what? Shock. So how is that? It might be related to it because it maintains the blood pressure. So it has work with maintaining of blood pressure. This part we call it the connection, the part that it has the connection with the blood vessels and ureter, and so the artery and vein and ureter, it is called the hylix. So this part is called the hylix. If you see, it look like the bean, حبة الفاصوليا, bean. And here in this side it is called the hylix. This is the aorta, as we said. This is the kidney, ureter. What is this part? This area, what we call this? It is the iliac crest, the iliac bone, the iliac crest. Sorry. And here this is the rectum, which is retro to the bladder. This is in female, this is the uterus. The uterus is coming over the bladder. So this is the uterus. Because of that, in case of pregnancy, when the lady is coming for ultrasound, they will tell her, don't void, take some water or fluid, then come for the ultrasound. Why? Because the bladder, especially in the early pregnancy, the bladder will push the uterus upward, so they can see it properly with the ultrasound. So the uterus is coming over the bladder, and also in case of pregnancy in the late stage of pregnancy, the woman is going more frequently to the bathroom because of the pressure of the uterus over the bladder. So she will feel the urge to go to the bathroom more frequently for a small amount of urine. And this is, we said, the urethra. So this is the main structure of the urinary system and the location. For the kidney, it is located toward the back. So the structure, if we come to the structure of the kidney, so this is the, we said that this part we call it the hylix, and this part here we call it the kidney pelvis. Actually, I prepared another slide which is more clear, but I don't know, it doesn't open with me. That one. So I will show it later for you. It's more clear than this one. So if we are coming from outside, this we call it the cortex, which is the shiny part covering the kidney. We call it the kidney cortex. And then the underneath it, this part here, it is called the medulla. So we have the cortex that covers the kidney. Then inside we have the medulla here. And here we have the renal, this is the renal pelvis. So this is the medulla. Those, it is, the shape of them, it is like what? The shape of those. How many angles they are having? Three angles. So it is similar to triangle, which is the pyramid. Because of that, they are called the pyramid of the kidney. So those are the pyramids. The pyramids are present in the medulla. So the pyramid, they are present in the medulla. So each one we call them pyramid. So this is, and in between those pyramid, this part, which is in between the pyramid, we call them the renal columns, which is the extension of the cortex from inwards. So blood vessels are coming inside them. This is, we call it the medullary pyramid, which is triangular region within the medulla, separated by renal column. Those are the renal column. Renal, this is the renal pelvis, as we said, the renal pelvis that is connected to the ureter. So renal pelvis, which is funnel shaped end with the ureter, that collect the urine from the tubules. And we have what we call it the calyces. Those are calyces. They are small tubes that are coming from each pyramid, from the nephrons that is present in the pyramids, and they are collecting. So the urine is coming through them, and it is collected in the pelvis. Then it will go to the ureter. So the calyces is cup-shaped structure that drain urine toward the funnel shape, which is the renal pelvis. So this is mostly the structure of the urine, so of the kidney. Those are the calyces. This is the renal artery, and this is the renal vein, and this is the ureter. Is there anything that you want to ask about the main structure of the kidney? So the main structure of the kidney, two layers is there, or if we are saying that it is a layer, it is the cortex, then the medulla. The cortex and the medulla. The cortex, which is the shiny part that covers the kidney. The medulla, it has inside the pyramid, and it has also this region which is in the renal medulla, and there are calyces. Then we have the kidney pelvis. Then we will come to the nephrons, which is the functional unit of the kidney. So the nephron, it is the functional unit of the kidney. So millions of nephrons are there within the kidney. They are present in the cortex and present also in the pyramid. So the structure and function of the kidney is there are millions of nephrons are there. They are responsible for formation of the urine. So the main structure of the nephron, which is the glomerulus, this is the glomerulus, and the renal tubules. Those are a very long tubes, very long fine tubes are there. The glomerulus, if we take it, it is, did you remember any shape like this in other system? Digestive system? Where is it in the digestive system? I don't know, it might be.
Intestine.
In the intestine? What is that part? Huh?
Capillaries.
Capillaries is there, but the shape, which is round shape or similar to sac. Lymphatic system.
Nervous
Might
system.
be, but
Nervous
it
system.
is
Nervous system.
nervous system.
And the mind.
You mentioned all the system, except the one that we want you to. It is not that much, but because that one it is different, but it is like a sac or similar. Respiratory, yes. So it is similar to the alveoli, but the alveoli from inside it is a sac. It is an empty sac that it will be filled by the. But here it is full of tubes. It is similar to the sac, but there are a big difference between them. But only we might say the shape is similar. But here there are, see, a long. This is the glomerulus, and there is afferent blood vessels. Then the blood vessel is going inside. Capillaries, it is full of capillaries. That capillaries, in order to filtrate the blood and get rid of the excess fluid and any toxic material and the end product of metabolism, it will be squeezed out from those capillary. So it will be squeezed out from those capillary, it will be accumulated inside, then it will go through those fine tube. It is a long run. Then it will go to the collecting tube, then it will go to the calyces, then to the kidney bulbus. Why it is a very long tube here, and it is going sometime down and sometime up, and why it is not only after filtration, after the fluid is coming out from the blood vessels, it has a shortcut to the kidney bulbus, and that is there. Why it is very long one?
More filtration.
Sorry?
More filtration.
More filtration. Filtration, where is it happen? Filtration,
Above.
it will happen inside this glomerulus. So the filtrate, it will come through those tubes. So there is no more filtration here. Huh?
Or above is
So,
specific.
so what might be there? See here what's going around them. What are those? Those lines, blue lines.
Capillaries.
Capillaries. Which type of capillaries? Is it arterial or venous? Venous capillaries are there. Why those venous capillaries are there? For what? What is the function of the veins or capillary part of the veins?
Take the blood and the retains.
Sorry?
Take the blood from the
It will take the blood back, but from the tissues, what it will take? So it will take carbon dioxide and water. So it is for reabsorption. So it is for reabsorption. Because if we come to the amount of the filtrate in each day, it is a huge amount. If it is going directly outside the body, in this case, we will get dehydrated within 1 hour. We will get dehydration within 1 hour. But most of the filtrate, it will be reabsorbed. And the urine, it will be concentrated. So most of the fluid, it will be reabsorbed, and the urine, it will be concentrated. Then it will go to the kidney bulbus, to the calyces, then to the kidney bulbus, and it will go as a urine. We will come to the function of each part of the nephron in one session, complete one session, inshallah. So we'll explain it fully. But now, the thing that you we have to introduce you to it, that the nephron is full of blood vessels are there, pressure, it will be from the arterial part, it will be high because of that, and you know that the capillaries, it is consist of how many layers? One layer. Because of that, it is easy for the fluid and the waste to escape, to come out from the capillaries, and this is filtrate. It will go through those long tube in order to do selective absorption. So there is selective absorption according to if the substance is excreted and the body is still in need for it, it will be reabsorbed again to the blood. So this is the glomerulus, by the way, and those are the blood vessels. for now, I will stop this session, and the next session we will continue, inshallah. Okay, thank you. Any question?